Hi, how can I help you?
Hi, our family, we just came from the doctor. Our daughter has flu, and we got these prescriptions.
Okay, let me just take a look. Okay, so it looks like one is for her and it's one for you.
And for the whole family.
Okay, no problem. So we'll go ahead and get those ready for you. If you just want to take a seat in our waiting room, it'll be about 15-20 minutes. Thank you. Hi, how can I help you?
Hi, these are prescriptions. We all have the flu.
We all have the flu.
Yeah.
Okay. All right, we'll get those ready for you. We'll call you up and page you when it's ready. Okay, so it looks like we have 2 families that are waiting, and it looks like they're all for Tamiflu.
Okay, how many do we have?
It looks like 6 total.
6. Oh no. I think we only have 3 boxes left over here. And it's a medication that's currently on back order. Yes. So, who do you think should get the first medications?
Well, from the first family, only 2 of them were for prophylaxis,
Okay.
and one of them, the daughter, had the actual flu. Whereas in the second family, all 3 of them had the flu. So it was the mom and dad and daughter. I would think the kids would get it. I mean, the second family definitely looked really miserable, but I think if it were up to both sets of parents, they would agree that their kids should get it.
Yeah, I would agree with that as well. But who should get the 3rd box?
Well, if we set both of the 2 ones we have aside for the kids, that leaves us with 1 left. So, I don't know, I think it comes down to the ethics. Should no one get it? Because, I mean, we don't have enough for either family, so what makes one family better than the other? Or should it be the first family who came to the register initially because they were the first ones there? If they're the first ones to get it, like, does that make it fair? I mean, what would you do if it was your family?
I would definitely want to keep it in my family. Personally, I wouldn't want to miss work.
Even if for just prophylaxis?
Exactly.
So,
But unfortunately,
but
that's
what if
not
it was
a
your
moral.
family, like, what if it was your family with the flu? Then that's even more of a reason to give it to them because they actually do have the flu.
Exactly. Let's bring in the families to join in the discussion. But I believe that we should give the medication to the patients who currently have the flu.
I would agree with that. I feel like it would do the most good in this situation, especially considering Tamiflu is advertised as treatment for the flu more than it is for prophylaxis.
Exactly. So let me get on the phone and call around to some of the pharmacies to see if they happen to have any in stock.
Okay, that sounds good.
Hi, this is John over at CVS Pharmacy. How you doing? I am actually looking for some boxes of Tamiflu, actually. You know that it's currently back order. We are almost all out of our medication, but we have more patients than we can fill. So we're just checking to see if you happen to have any in stock. Oh, okay, I see. All right, thank you so much. All right, bye. Hi, this is John, the pharmacist over at CVS Pharmacy. We're right over on Shady Grove Road. I was checking to see if you happen to have any Tamiflu in stock. We are currently out, and we are trying to fill some for some of our patients. Oh, you do? You have 1 left in stock? All right, great. Could you put that aside? I'm going to fax over a prescription for Mr. Douglas, and we'll send him over maybe 15-20 minutes. All right, thank you so much. All right, bye. All right, Heather. It looks like a store down the road actually has a box of Tamiflu in stock.
Oh, awesome.
So we're having them fill it right now.
Okay.
Maybe you could update the patient.
Okay, no problem. I'll do that.
Thank you.
Chen family to the pharmacy at your convenience. Hi.
Hi.
I just wanted to give you an update on your prescription. So I have Erica's prescription ready.
Okay, great.
However, many pharmacies in the area, including ours, are currently going through a Tamiflu shortage just because this flu season has been so bad. So we actually have a very limited supply. All we have is 3 boxes total available, including the one in this bag. So it's even on back order, so we don't know when we'll be getting more in. We also have a few patients who currently do have the flu, like besides your own family. So we were wondering if it was okay with you if you would give the remaining 2 boxes to those patients who currently do have the flu. I mean, we do have the one for Erica, but for you two, it was for prophylaxis, so to try to prevent it. But I mean, in return, we can also just give you different tips and advice on how to protect yourselves from the flu and how to prevent it from spreading from your daughter to yourself.
Okay, we completely understand.
Okay.
We know that the people who actually have the flu would probably benefit more from the drug.
Okay, great. Thank you so much for understanding and here's your prescription.
Thank you.
Alright, so what you will want to do to prevent the spread of germs is to wash your hands often, either with soap and water or possibly an antibacterial rub. Also, just avoid touching too many things that are high contact, like doorknobs and tabletops, and wipe them down a bit. Also, to help fight off your infection, you could also just eat more healthily, get more exercise, get more sleep. Some general tips on dealing with the flu.
Okay, great.
Excellent.
Thank you so
If you all
much.
need anything else, just feel free to give us a call or come on back in.
Thank you.
It's nice to meet you all.
Douglas family to the pharmacy at your convenience. Hi. So we have 2 of your prescriptions ready. I know you brought in 3, but just a heads up, a lot of pharmacies in our area, including ourselves, are going through a Tamiflu shortage. So we have the 2 available for you, but we can't even get them ordered for you because it's on back order. So our pharmacist went ahead and called another pharmacy down the road. And what did they come up with?
Yeah, they actually have a box in stock. I called over and we're going to get them to fill it in the next 15-20 minutes. So after this,
Where is it?
2 blocks down the road, on the right-hand side. So if you just head on down there after you pick these up, you are free to go.
Yep, so here's your prescription. Sorry about the inconvenience, but hopefully it'll help you guys get better.
Thank you so
Thank you
much.
so much.
So do you think we did the right thing?
I think we did. We went above and beyond and tried to find stock at another pharmacy. We were able to give both kids the medication, and we did our best effort to satisfy both patients on the parent side as well.
Yeah, I would agree with that. I think we did the most good with the best we had. And that we only had the 3 boxes of Tamiflu. So I really do think that we prioritized as best as we could and with the best interest of each person at heart. So, I mean, I just hope that the Chen family doesn't get the flu and they definitely take into consideration the tips you give them, and we can just hope for the best. And if they come back with the flu, we'll hopefully be able to get them some more boxes of Tamiflu in time.
Exactly.